So thank you, and now I'd like to turn it over to Dr. Ezike for today's medical update.
Good afternoon, everyone. Let me start off by announcing that this week, again, I'm a few days late, the Illinois Department of Public Health is celebrating National Emergency Medical Services Week. And we want to recognize the important contribution and dedication of the paramedics, police, firefighters, and other first responders who provide day-to-day life-saving services. Emergency workers are willing to put their lives on the line every day to help protect the health and safety of their communities. I want to thank all of these brave men and women and recognize both their courage and their dedication, especially during this pandemic. Please join me all in recognizing our emergency workers during National EMS Week. And now to the medical report. Today, we are reporting 2,268 additional individuals who were diagnosed with COVID-19. We now have a total of 102,686 confirmed cases throughout Illinois. Since yesterday, unfortunately, we received a report of 87 additional lives lost for a total of 4,607 fatalities. A total of 672 tests have been run, with 29,307 tests being reported in the last 24 hours, our highest total to date. As of last night, 4,107 individuals were in the hospital with COVID-19, and of those, 1,088 patients were in the ICU and 609 patients were on ventilators. We have been talking about this novel coronavirus for months now, and we have learned a lot, but there are still unanswered questions. We have learned that people infected with the virus can spread it to others even a few days before they start feeling sick. There are instances where people who do not have any symptoms, or the symptoms are so mild that the person may not seek or need health care. However, a person who is asymptomatic can potentially still spread the virus, which is why testing is so important. So there are still questions we don't have answers to, such as, after a person is infected with the virus, are they immune? Can they get infected again? If a person is infected, can that person's blood or the plasma from the blood, can that actually be used as treatment for others? We are still learning the answers to these questions and many, many more. We're trying to learn them as quickly as we can, but we must use what we do know to be true to help protect ourselves and stop additional spread. And what we do know are the same things we've been saying from the beginning. Social distancing does work. We now know that wearing a mask can actually help prevent the spread of the virus, and washing your hands can prevent not just coronavirus, but so many additional viruses and other pathogens as well. Let's take it slowly. As we go into phase 3, as we continue to learn about the virus, we want to move towards continuing the reopening, but we need to do it in a smart way and in a safe way, and that means following the science. Thank you. And now I'll repeat comments in Spanish. Buenas tardes a todos. Esta semana, el Departamento de Salud Pública de Illinois celebra la Semana Nacional de Servicios Médicos de Emergencia y queremos reconocer las importantes contribuciones y dedicación de los paramédicos, la policía, los bomberos y otros primeros respondederos que sirven nuestras comunidades. Los trabajadores de emergencia están dispuestos a arriesgar sus vidas todos los días para ayudar a proteger la salud y la seguridad de sus comunidades. Quiero agradecer a estos valientes trabajadores y reconocer su valor, tiempo y dedicación, especialmente durante esta pandemia. Únase a mí para reconocer a nuestros trabajadores de emergencia durante la Semana Nacional de EMS. Hoy informamos 2,268 personas adicionales con COVID-19 está reportado. Ahora tenemos un total de 102,686 casos confirmados en Illinois. Desde ayer, 87 personas adicionales con COVID-19 han muerto, para un total de 4.607 muertos. 29.307 pruebas hechas fueron reportadas en las últimas 24 horas. Hasta anoche se informó que 4.107 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1.088 pacientes estaban en la unidad de cuidados intensivos y 609 pacientes estaban en ventiladores. Hemos estado hablando sobre este nuevo virus por meses y aunque hemos aprendido mucho, todavía hay preguntas sin respuesta. Hemos aprendido que las personas infectadas con el virus pueden transmitirlo a otros un par de días antes de que comiencen a sentirse mal, si tienen síntomas. Hay casos en que las personas no tienen ningún síntoma o los síntomas son tan leves que la persona puede no buscar o necesitar atención médica. Sin embargo, una persona asintomática puede transmitir el virus. Eso es porque las pruebas son muy importantes. Pero todavía hay preguntas para las que no tenemos respuestas. Por ejemplo, después de que una persona se infecta con el virus, ¿son inmunes o pueden volver a infectarse? Si una persona está infectada, ¿se puede usar la sangre de esa persona como tratamiento para otras personas? Todavía estamos aprendiendo sobre el virus lo más rápido que posible, pero debemos usar lo que ya sabemos que es cierto para ayudar a protegernos y detener la transmisión adicional. El distanciamiento social funciona. El uso de una máscara puede ayudar a prevenir la transmisión del virus. Y lavándose las manos para prevenir muchas enfermedades diferentes, aparte de coronavirus y coronavirus también. Vamos en rumbo a la fase 3, pero todavía tenemos que seguir con cuidado. Si lo hacemos bien, nuestro futuro será más brillante. Gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. I'll keep it fairly brief today, but there are a few pieces of news that I'd like to announce. I'm proud to share that Illinois has received an additional $1.3 million in Family Violence Protection Act funds through the CARES Act, allowing us to provide additional holistic services for domestic violence survivors and their families as we work to see all of our residents through this pandemic. This is in addition to the more than $1 million of additional state funding to support those who've experienced domestic violence that I announced earlier this month. Thanks to the creative team at the Illinois Department of Human Services, Illinoisans experiencing domestic violence now have greater access to alternative housing initiatives, transportation assistance, food, and supplies. Of course, we couldn't do this work without the assistance of the many local shelters and service providers that play such a critical role in their communities. Earlier this month, I was joined at our daily update by the executive director of APNA-GAR, which focuses on serving domestic violence survivors in immigrant communities in Chicago and the suburbs of Cook County. And there are dozens of organizations across Illinois ensuring that all of our residents can find the help that they need. Places like Sojourn Shelter here in Springfield, the Center for the Prevention of Abuse in Peoria, and the Cairo Women's Shelter in Southern Illinois, and A Safe Place serving Lake County and Northern Illinois. To access counseling and advocacy, legal assistance, and children's services, or to find a shelter near you, please call our 24-hour Illinois Domestic Violence Helpline, 1-877-2-END-DV. That's 1-877-863-6338. These services are free and completely confidential for all residents. I also want to let everyone know that yesterday, the most recent round of funding from the Illinois COVID-19 Response Fund, over $6 million, went out to 31 nonprofit organizations all across Illinois. The fund has raised more than $30.5 million, and that's all just since the fund was launched on March 26th, less than 2 months ago. I want to offer my gratitude to each and every one of the 2,800 donors who made that possible. And while I can't list out each and every name, let me specifically recognize some of the fund's lead donors: the Bloom family, Joe and Rika Mansueto, the Staines family, the Crown Foundation, State Farm, Caterpillar, Exelon Corporation, ITW, Northern Trust, and the MacArthur Foundation. In total, over $16 million of those funds are already delivering much needed support to Illinoisans, with 62 unique organizations receiving direct assistance. And because many of these are umbrella organizations that have distributed funds to smaller groups in their communities, the Response Fund has reached nearly 800 unique organizations to date. It has been incredible to see so many Illinoisans and Illinois companies willing to give to their neighbors in these trying times, and more so to see the vast network of nonprofits and volunteers who are on the ground serving families and helping them stay on their feet. From the Boone County Community Foundation to the Catholic Charities of Southern Illinois to the United Way of Greater St. Louis and countless others, the people of Illinois prove themselves to be the kindest and the most generous people in the nation. So thank you, and now I'd be happy to take any questions from members of the media.
We'll start with Amanda, Greg, and then go online.
Great.
Thank you so much, Governor. Hope you're doing well.
Thank
so
you.
Quick question there. Did you get a COVID test before you came to Springfield after you had been isolating?
I did not. I was tested before I was isolated, and because I isolated the entire time right up to the point where I came to Springfield, I didn't get another test.
One of the measures that the General Assembly is working on is this vote by mail. So several questions there. I'll try to group them together. For one, does it go far enough? This would merely be mailing to people who voted in recent elections applications for vote by mail. You had wanted actual ballots mailed. So does it go far enough? And then on the opposite end, some Republicans are saying that this could lead to ballot stuffing. So how do you ensure the validity of this, particularly that President Donald Trump has raised questions about voting by mail?
Well, this has obviously been a Republican strategy all across the country to deny people the ability to actually go to the ballot box or to deliver their ballot to vote. Republicans, generally speaking, have been in favor of suppressing the vote all across the nation. They think it's bad for them if more people vote. I think everybody has the right to vote. We live in a democracy. The vote is sacred. And so I'm very much in favor of making sure that everybody gets a ballot who is eligible to vote and then returns that ballot.
So does this go far enough?
In my view, I would like more done. And of course, this has been a discussion, a negotiation, conversation, better said, about how to make sure that the most people get it, and that, we're doing the best we can with the resources that we have. So allowing people, to sending out ballots, or rather applications, to everybody that voted in the last number of elections, and still giving everybody else the ability to apply to get a ballot, I think is a reasonable compromise and gets us what we want, which is people don't need to go to a physical balloting location. And you see, by the way, that there are other aspects of that legislation that do provide easier access to the ballot box for people who do need to go in person and may want to in the days and weeks, indeed more than a month and a half, or about a month and a half before the election.
Concerns about Illinois losing federal funding, giving threats by President Trump regarding states that do proceed with expanding vote by mail. Is that a concern? And this is from Mark Maxwell. Jumping off of that, you have made similar threats to local governments in terms of holding up funds from the state if they don't comply with your executive orders. So why might it be bad when the president does something like that, but okay when you do it?
Well, there's an awfully big difference. The president is threatening to take away funds from states doing something that's legal. And what we were talking about, as you suggest, in the weeks before, about the possibility of holding up funding for local governments because they're not following the law, that's a much different thing. But look, I think it's very important for people to get access to the ballot. The president doesn't want that. I do want people to get a ballot and to vote, and that's just an enormous, enormous ideological difference. I believe in democracy and the right to vote.
Coming from Rick Pearson of the Tribune, the Republican delegation to Congress has sent you a letter that wants to know more about what Illinois is doing as it allocates federal funding that it has received for the coronavirus response that was appropriated recently, of course, under the CARES Act, citing a report from the National League of Cities that says Illinois is a state that is withholding funding from municipalities.
No funding is being withheld at all. We need enabling legislation. We needed the legislature to actually get together to provide that enabling legislation, and that's what's happening over the next day and a half.
I know that there were a lot of folks who rejoiced about your announcement yesterday, and yet a lot of questions. So I'm going to try and rapid fire these from news organizations. For starters, that Mayor Lori Lightfoot in Chicago has said that restaurants in the city are not going to be able to open restaurants by the end of May. What is your response to that? And does that underscore complaints, particularly from leaders in the collar counties and the suburbs, that they have been unfairly lumped in with Chicago?
Well, the decision by a municipality like Chicago to not have outdoor seating is completely up to them. As I've said all along, we've tried to provide a baseline to protect people in various communities in different cities and counties. They can do something that's more stringent and decide not to allow certain activities because maybe they're a hotspot, maybe they're concerned about something in particular that they want to deal with on a local level. But I think many towns, cities, and counties across the state will, in fact, be having outdoor seating for restaurants, and those that choose not to, that's a completely local decision.
And you did ease up on those restrictions, obviously, from the original Restore Illinois plan. Mm-hmm. Again, we're still hearing a lot from those suburban leaders and Collar County executives that are saying, why are we part of Cook County in Chicago? So do you have any plans, any second thoughts as to whether that might change?
That's not something that I'm looking at doing, and we have 4 regions. They've all been moving in the right direction. You see that everybody in Illinois now, all 4 regions, are not only moving in the right direction, but are going to be able to, barring some catastrophic thing that may happen in the next 8 days, will move into the next phase.
Block Club wants to know more about how people can safely meet in these 10 groups of fewer. Should it be the same 9 people that those can see, or can we, for the next phase where we're allowed to gather with 10 people or more, does it have to be the same 9 people? Do we need to still wear masks? Can people hug and touch?
Maybe I missed the first part of your question. In a specific circumstance?
In this next phase, yes, where the gatherings of 10, I think people have a lot of questions as to how they can do that safely, comply with the law. Yeah. So for example...
Yeah, it's about social distance. I'm sorry to interrupt if there's more. It's really about social distancing, wearing face coverings, making sure that you're keeping everybody safe that's with you. That's really the goal here. We want people to get together to enjoy themselves. Remember, in the phase that we're in now, in phase 2, we don't have just anybody meeting in groups of 10 or less, right? It's meant for essential workers or in other circumstances that are required. But in the next phase, really any group of 10 people can do it. But again, the idea here is to make sure that we have safety is an uppermost concept in people's minds when they're getting together. Wear a face covering, keep social distance from one another, and outside is always the best circumstance.
Cisco Cotto from WBBM News Radio follows up with that, saying that retail stores are going to, in phase 3, be able to reopen with capacity limits. Mm-hmm. There are, of course, large places of worship. Will they be able to observe capacity limits in phase 3 as opposed to the restriction of 10 people or fewer?
Well, again, capacity limits are intended, we're still in a phase where 10 people or fewer is the desired number. That's what the epidemiologists are recommending and so on. Many small stores, that is a number that may be less than they normally have in their store, but it's still a reasonably good number, and they can keep track of people who are coming in and out, and those who can't fit in can certainly socially distance outside as they wait to go in. With regard to churches and mosques and synagogues, I think it's important for people to be able to get together and worship, but again, we've got to follow the same rules. The whole idea here, this isn't something that I made up. This is something that the epidemiologists really have emphasized, that until we know whether having larger groups together, and what the effect of that is, we need to watch what it's like when we let everybody get together in a group of 10, in groups of 10, even with social distancing. We don't really know, right? And what you're doing is watching, and that's why you have a phase, right? We're watching week by week, day by day, through the phase to see what's the effect on the number of people who are coming down with COVID-19, the number of people who end up in a hospital. And you'll see as we move forward, and we'll provide you with more data, but you can see it yourself if you go to the DPH website, that it takes several weeks for these things to work through. Groups of people get together and they do something that they shouldn't have done, and someone spreads it in a group. You don't see an immediate effect. 2 weeks later, you start to see maybe people are entering the hospital, more people are entering the hospital, and then perhaps 2 weeks later, you're seeing people going into the ICU and perhaps on a ventilator. And even a week after that, perhaps people dying. And so that's why we're trying to, take a gradual approach here to all of this.
Today, the Illinois Department of Employment Security came out with new figures, pretty awful ones, regarding the number of people who have lost work last month, and yet there continue to be issues with IDES and filing for that. Elizabeth Matthews of Fox asks about someone who was given a runaround as they tried to receive pandemic unemployment assistance, that a caller hung up. So are workers properly trained for this, or was training at all rushed? And can you address as well just the general high figures of unemployment?
Yeah. Let me start with just saying that this is a tremendously disturbing problem that everybody in the country is facing. I mean, the high unemployment, the number of people who have been furloughed, laid off, perhaps permanently, the number of businesses that, especially small businesses, which are really the lifeblood of job creation in our country, right? Those small businesses, when they close up, it's hard for them to restart. And it's a tragedy that requires us to really put shoulder to the wheel to make sure that not only the federal dollars that have been provided through PPP, but also the state COVID relief effort is working to revive employment and revive small businesses and to get people back to work. That's certainly an extraordinarily high priority for me. As to people who are experiencing problems connecting with unemployment, and I know the PUA system, as you mentioned, look, there are going to be these circumstances. There have been. It's not something that's not excused in any way. It is something that when we have these rush of applications that come in a single day, the number of people answering the phone, there's only a certain number of people who can, and then things are going to happen. I mean, there's no doubt that mistakes get made. If somebody gets cut off the phone line, it's not because there's somebody on the other end who's saying, I don't really want to do that work, and hitting a button. That's not what's happening. I mean, you should see these IDES employees. There are people who are yelling at them because they're angry about their situations, but the IDES employees are working so hard to try to get the job done. And I just want you to know that for people who are continuing to have difficulties, please keep trying. We've been doing our best to expand the ability both to take phone line calls as well as online applications.
When it
Amanda,
comes
we'll
to,
let you do one more and then move to Greg.
I've got
two.
budget and contact tracing questions. So, and actually a follow-up as well too, in terms of unemployment, lots of questions about childcare. Can somebody receive unemployment if they are not able to find childcare? Or What are we doing? I know you've talked about expanding childcare, but people are still saying they're having access issues.
Yeah, you mean, can they get childcare if they're on unemployment? Is that
Can
your
they,
question?
no, if they are unable to find childcare,
Uh-huh.
can they continue to receive unemployment? There are those who say that they are fearful that they won't be able to go back to their job because they have nowhere to send their children. Then therefore, what do? Quit?
Right, so that's one of the things. Number one, as you know, we created emergency licenses, and we've licensed more than 2,500. I think we're at about 2,650 or more emergency childcare locations. Remember, you have to back up just a second. This isn't a desire on any of our part to limit childcare. The idea here is that with everything that we know, especially the potential that there are COVID-related illnesses that can befall children, that we want to make sure that we're also limiting the social interaction, the numbers of people that are in a childcare setting, both the children and the adults. And so this is obviously a difficult circumstance when you think about most childcare facilities have many more than 10 children. They may have 15 or 20 in a space, and then they have multiple spaces, and they often are, running into each other in the hallways under normal circumstances. So when when we have a pandemic and a mystery, that is COVID-19 that we're all trying to unravel, and we're trying to protect people, we've got to move to what's the best way to protect them. And so moving to these emergency 10-person, 10-child facilities has been the best thing to do. Now, we also need much more childcare. And so we're working with childcare providers. It's a long answer because I really believe, understand, I really believe in providing childcare for families. This is, it's something I've worked on a long time, and I've been expanding into the state of Illinois before COVID-19 came along. So it's something I believe in. So we are working with childcare providers to try to figure out how in their facilities where we've only said you could have 10, is there a way to keep children separated in groups of 10 without having the kind of interactions that you normally would have in a childcare facility between all the people, the teachers that are there, the childcare providers, and the children themselves. So we're working on it. We have a task force of childcare providers who are motivated, trust me, to want to open their facilities. And I am motivated because I know as we get people back to work, they need more childcare. So we've been at this for some time. Suffice to say, my deputy governor and my first assistant deputy governor are on top of it and working with this task force to make sure we expand it.
I have two topics to cover. I know Greg and I spoke beforehand to try and make sure that we covered all the bases of the many questions we're getting from journalists throughout the state. So one of them is about contact tracing. I'll group those together as well. The first is Apple and Google are now out with apps that have these abilities to do some of that contact tracing work. So can you respond to that, particularly given Illinois biometrics laws and limitations, fears about breaches? And just in general, you've made an announcement, I believe it was Monday, regarding pilot programs. We've had coronavirus in the state of Illinois for 4 months now. So what good is contact tracing at this point where we've hit 100,000 cases, 100 plus counties? Is it too little too late?
Well, let's start with no state had contact tracing to be able to reach every contact for someone who tested positive for COVID-19 when this thing started, and nobody really knew how big this was going to get. And so when you start to have in a state like ours thousands of cases, and when you're testing as much as we are, this is a huge positive to be able to test as much as we are, but at the same time you're finding more people, and therefore put some multiple on each case, and you'll determine how many contacts need to be made just for every single day. Think about that. So as that started ramping up, what we had for contact tracing in the state, and we do have contact tracing, it always was here, HIV focused or even flu focused, but contact tracing was not big enough to handle a pandemic. There's no doubt about that. And I would say in no state was that the case. So as we talked about the other day, we have 29% coverage, and we can get probably to a little above 60 perhaps. So we need to double what we're doing today. And that's what this contact tracing endeavor is. Why would you keep doing it? Because guess what? Every day, we just announced 2,500 roughly cases. Again, today, we'll multiply 2,500 by the number of people that each one has been in contact with. That's a lot of contacts to make. So again, every day we're adding to the new number of cases and therefore number of contacts that need to be reached. So that's why we're continuing to spin up our contact tracing. One more thing.
And the apps.
Yeah, one more thing is the surge that I think people, I don't know whether there will be one. I'm not an expert enough, and frankly, the epidemiologists don't definitely know whether there'll be a surge. We can all cross our fingers. The fall is expected to be a time when we might see another surge, a surge, and I'm very concerned about that. And so we need to be ready for that. And so you'll see so many other preparations. You know, for those who think, well, this is all dying out, it'll all be fine by June. I mean, unless there's a vaccine or a very effective treatment. And so if it doesn't go away, and I don't think people are expecting it to, it means that we have to be ready for the potential of a surge. Contact tracing is just one of many items that we're making sure that we keep warm, that we've got working and operating alternate care facilities. You all saw we built out McCormick Place and other places, because if we had been on the path that we were, if we had continued on the path we were on and hadn't done the great job that people in Illinois had done, staying at home, doing the right thing, that number would have gotten huge. We would have had to use those alternate care facilities. Well, imagine the fall comes and, we have to move backward somehow, or, that would be a terrible thing. So the contact tracing is just one piece of a number of things we need to be ready for going forward. Apps, last thing, look, privacy is a huge concern, online privacy, a huge concern. We have good laws on the books today. We probably need even more privacy legislation, but suffice to say, there's nothing that we're going to do with our contact tracing that will violate those laws. And the Apple and Google app that you're talking about is something that, genuinely I'm a little concerned about, because it potentially, and I don't know the intricacies of it, but I've read enough to say it potentially could invade somebody's privacy. Having said that, we do need to make sure that we're doing our best, at all levels to identify contacts, and it may be a worthwhile thing for us to do if we can maintain people's privacy.
And my final one, before I pass it to Greg, would like to focus on the budget.
Yes.
And
Oh, yeah.
that would be, obviously, we are here in Springfield, a day and a half left of session, and not many bills have gone through to you just yet in this short period. So when it comes to the budget, your original proposal called for putting money in reserves that counted on your graduated income tax constitutional amendment getting approved in November's election. Is that still what you want to happen, or given the great many other unknowns having to do with borrowing what we will or will not get from the feds, how conservative do you plan to be in terms of spending with all of those outliers, those monster question marks?
Well, let's be clear that the budget that is now in the General Assembly is one that the General Assembly has worked very hard on. It comes, with an outline that perhaps started with what I had in February proposed, but today is much different. I mean, obviously, we are in a much different situation for our state. So I'm going to look at what the legislature has done. Our team has been responsive to questions the legislature has put to us. We need to make sure that we're working together as best we can to have a budget that pays the bills for the state. And as I've said many times before, we have a sincere hope and belief that there will be help that comes from the federal government, because without it, we will, this state and states all across the nation will end up laying off firefighters and police officers and nurses and so many other people, and the services that people need exactly in one of the worst economic circumstances that we've had will go away without that federal help.
Governor Greg Bishop of thecentersquare.com.
Hi, Greg.
A lot of questions coming in, of course, about unemployment. I've got a few of my own. Talking with some state lawmakers, Fred Crespo being one of them. He said that he's talked with IDES, trying to get answers.
Yeah.
Says that it's time for you to work with the legislature
Yeah.
to do something about this problem.
Sure.
When's that going to happen, and what does that look like?
Well, we've talked to the legislature about, particularly with the budget, as you know, IDES is one of those agencies that was woefully inadequately funded for many years. And we talk about government getting hollowed out over the last few years. That's just one of the agencies, but it is one of them. And you can imagine that, well, gee, when the economy is getting better every year, people don't pay much attention to the unemployment system because it's, you know, it's small. It doesn't really affect that many people. That's the theory that the General Assembly has gone by for many years. Now here we are, right, with all that underfunding affecting IDES. So I am absolutely, we're working with them on making sure we get the right funding levels for IDES, and secondly, that we are working to use that funding to upgrade the systems that exist and the people, because there's been a drop in the number of employees.
And a follow-up with the unemployment issue. Businesses have made significant sacrifices during the pandemic.
Yes.
How is your administration going to help offset the expected increased burden because of unemployment insurance?
Yeah. So again, two things to keep in mind. I mean, first, this is you know, typically unemployment is something that is an agreed upon understanding between business and labor and, you know, employees. And so we're going to continue that. But as every state in the United States, and I've talked to many Republican and Democratic governors about unemployment in particular, and about the funding of unemployment, again, this is part of what the CARES Act, or this next HEROES Act, addresses, is unemployment support, and we're going to need that like every other state.
Also, with unemployment, when do you anticipate things getting back to normal? This is from Peter Hancock at Capitol News, Illinois. And are the programs now in place, extended benefits and the federally funded pandemic-related extensions, going to be enough to carry people through?
I'm concerned that it's not enough. I'll be honest with you. I see the $600 extra that people got and are getting in unemployment benefits. Even that, you know, added on top of the existing unemployment benefits, doesn't seem to be enough. And when you think about the amount of time that it looks like that the economists, not me, but the economists are saying that it might take us to get back to normal, I'm concerned that, you know, that the typical number of weeks that are allowed may not be enough.
Onto the budget. How realistic is it for the state to spend around the same next year as it's spending this year, given the state's dire financial situation?
Yeah, so again, one of the challenges when you get into an emergency, when you get into an economic downturn, is that you have not only an increased number of people unemployed, a decreased number of people who are paying taxes, revenues dropping for the state. You also have a massive increase in the amount of services that people need. When middle-class families drop their incomes substantially, people who've never needed the state's supports, perhaps, now they need that support. So you can't say as a state, well, we're just not going to help people. And that's why we've asked the federal government, like all the other states, that, you know, for help. We're just trying to replace the revenues that were lost. This is not anything more than that.
Well, on that question about getting funding from, like, the Federal Reserve Fund, for instance, I spoke with Congressman Ronnie Davis today. He said, you know, it's a good program, glad the state's looking into it, but he says it still doesn't take away the bad policies the state's had in place for decades that have led to a lot of the underfunding that's happened even before the pandemic. Is it time to reassess those programs and the policies that have been in place to, you know, ensure that we're ready for any other possible pandemics or any other disasters that may be down the pike?
Sure. First of all, once again, if all we did was restore the state to where it would have been, we still would have challenges, no doubt about it. And that's not something that's started this year, right? That's something that existed for years before I became governor. So I think that Congressman Davis probably does understand that, balancing the budget is a hugely important goal of mine that I've been, focused on since before I became governor. We balanced the budget. The only budget that I put forward, the first budget that I put forward, was a balanced budget. Indeed, even reporting, you could look at COGFA numbers and others, even reporting up to the time of the pandemic, we were on track to have a mild surplus in the state, something that hasn't happened for a long time, which would have been used to pay down some of our bills. We were on track to do better. Obviously everybody has a different opinion about how much you should do, how fast, and so on. But here we are. Look, here we are. We have to take care of people in our state who need us at this exact moment. This is what government is for.
Well, but on that, you've said multiple times we would have had a balanced budget if it wasn't for the pandemic.
Yep.
Comptroller put out the COGFA, Comprehensive Annual Financial Report. It said like $197 billion of unfunded liabilities. How can you say it's balanced if you've got those massive liabilities?
Right, well, that's a balance sheet issue, just to, separate these things, right? You've got an income statement essentially for a state budget, and you've got a balance sheet. And there's no doubt that there are challenges in our balance sheet, right? And these are, again, things that have occurred for many years. And you know that I've talked and indeed put forward plans and indeed got some of them passed to start to, make changes in the way we deal with our balance sheet. So I'm going to continue to do that, but right now we have to focus on just lifting up, providing supports for small businesses, for families, for people who've never been in this situation before, and the people who have been for some years in need of social services.
We'll get to a variety of other issues outside of the budget, but just to follow up on the budget, since it is budget season, we've got June 1st.
But budget
July
season,
1st.
all 3 days of it?
Right, exactly. After this is done, is it time to reassess the policies that have led to, before the pandemic, the incredible financial problems that the state's had?
Yeah, and as I say, when you set aside, and it's hard to do that, but setting aside the question of the effect that the pandemic has had on our budget, if you were able to put that aside, we've been making progress. And, again, we have differences of opinion about how fast that progress is and what we ought to be doing. This is not a business, though. I want to be clear. Running government is not like running a business. You would take maybe different measures if you were running a business. Here, our job is to take care of people. That is to say, people who are in need, people who are falling through the cracks, people who are in extreme poverty, people who now have lost their jobs, people who need medical care, who no longer have insurance. So our job is to provide those services for them in government. And so for people who want to make massive cuts in government today, think about who you're doing that to. You're doing that to the middle class. You're doing that to the working class. You're doing that to the people who need government the most.
State Fair, big economic driver here. My colleague Jim Leach at WMAY asking, Ohio has just canceled their 2020 State Fair. When do you expect to make a formal decision on the State Fair here in Illinois? And if so, if it's canceled, how do you comply with the state law that says the fair shall be held in DuQuoin and Springfield?
We're working on that now. I don't have an answer for you. We're still trying to figure out what we can do, if there's something we can do. But again, on the current situation of phase 2, moving into phase 3, we couldn't do it within that time frame. But it isn't scheduled for that time frame. So I'm very hopeful. Once again, I've said all along that the greatest thing that would happen, and I hope everybody will put this in their prayers today, would be an effective treatment and or a vaccine, because if that happens, then we can do things like have the state fair.
I think that law says an annual fair shall be held. So do you think it would be something, you may cancel it, but then revisit it and see if we can postpone it or something to that effect?
I think all of us enjoy the state fair. So, I would love to make it happen. We just have to, do the best we can.
Matt Roy with WICS News Channel 20 asks, we've received a lot of calls from youth sports leagues wondering what specifications are in place for when phase 3 and 10-person gathering sizes are happening. Mainly, they've been wondering if there will only be 10 on a still or multiple groups of 10. Can you offer any clarification when it comes to the phase 3 for gatherings when it comes to sports?
Yeah. We're certainly working with IDPH to make sure that summer sports, to the extent we can do it with 10 or fewer people, that we want to make that happen. Again, more outdoor activity within the parameters of what the epidemiologists are saying I want. I think it will be difficult to have crowds in a stand watching those games, but I know that there are Little League games and other sports during the summer that perhaps could happen And again, we're working with IDP, or IDPH is working with folks who run those games to make sure that, if you can do it, that they're done safely.
It sounds like another guidance type question from Chris Carter at WA&D. They've talked to several businesses and salons who've been expressing concerns about opening next week if they don't have guidance from IDPH. When will those guidance documents be available? Will those guidance documents include things like partitions between tables and a variety of other things seen in other states?
Very soon. Very soon. I don't know if Jordan can answer the question, but, we have guidance documents that are being
Yeah,
prepared,
it's in
work
the
that's
next few
already
days.
been done to make sure that people have enough time, we hope, to open safely.
Question for Dr. Ezike. Please explain why state testing numbers per county do not add up to the total number of tests that were reported by the state online. And also, how can you assure people in Illinois that the state has not reported antibody tests or manipulated data the same way the Associated Press has reported that other states have done? That's from Mark Conkle at thepatch.com.
So again, we have over 100,000 tests. And so when we think about the amount of data that's being collected by the department, and we have multiple sources of data. We have data that comes in electronically. We have data from sources where they're not electronic, and so they're sending faxes. So when you're trying to aggregate these very large amounts of data pieces and put them all together, and then you have issues of maybe a testing site didn't have all the fields filled out, and so it wasn't clear who to ascribe, which county that actually belonged to. When you deal with all of those pieces and you're dealing with such large numbers of data, you can imagine that there might be counts off by, 100 here or there. And out of a giant denominator of potentially, hundreds of thousands, please know that, yes, maybe there might be numbers that would be off. We do work, we have quality assurance, people who are looking at the data, trying to make sure that it all adds up. But I'll just say that when you're dealing with hundreds of thousands of pieces of data, it is possible that they aren't going to be a perfect add up, but I don't think they're off by much. And I think our data teams, both at the county levels as well as at the state levels, are constantly doing our data quality assurance to make sure that we get those things to add up as closely as possible.
For Michael Coolidge, WROK Rockford, if I could just do a couple of quick ones.
Can we combine them? I've got like 20
Understood. So Michael Coolidge is asking about other states that have opened up, Governor, and maybe even Dr. Ezike, if this is appropriate. But Florida, Georgia, they've opened up. They haven't seen an increase in cases, but they've seen an increase in economic activity. Michael asks, do you owe a sort of apology to those states for saying that they're doing this wrong and jumping the gun and reopening their states?
Well, I think I expressed my deep concern, and I think now you're seeing that in Florida, perhaps the data isn't accurate, right? They fired the person who was managing the data, and she says it was because she was trying to report it accurately and couldn't. So I can't speak to the comparison. I can only tell you that we're in our state doing the best we can to open carefully. We're not, an outlier in any way. There are many states that are following our lead and I think doing it in the right way. But look, our number one consideration, again, is to keep people out of the hospital and make sure that we are providing the healthcare service that people need. And, hopefully we can continue to reduce the outbreaks.
And then just real two quick lightning round type questions. When are state employees going to be back to work?
Mm-hmm. Yeah, in phase 3, we'll be bringing them back, as you've seen, DNR, as we will open all the state parks. All the DNR employees will be back. We're moving people back as fast as we can, but to be clear, just as with offices, remember, as we open in phase 3, lots of offices, businesses that are in offices, have to follow certain social distancing guidelines, and therefore telework will continue. That's very likely to continue for state workers as well.
And then I've had multiple questions come in, even from listeners and readers. Secretary of State's office is doing some drive-up stuff for license plate renewals, but when are 16-year-olds who haven't had a license yet, or some of those older Illinoisans who maybe haven't had a license for years, when are they going to be able to get that freedom of mobility again?
That's a decision that'll be made by the Secretary of State's office.
All right, we'll go to questions online. Dane Placco at Fox 32. Numerous construction workers from the Chicago area are driving up to Wisconsin every day to work on a large construction project on your Kenosha County horse farm. You've been vocal about urging Illinois residents, to not cross borders. Does this travel square with your advice? Are you concerned they're traveling to a state that is essentially opened up?
Well, first of all, they're operating an essential function. Construction is an essential function. And second of all, they're union employees that are going to do the work that they do. And I've never said that people can't cross the border into another state. That's not something I've said. I have warned people against crossing the border and going into situations in which there's no social distancing, people aren't following any of these rules, right? Not wearing face coverings, not washing their hands, all the things that can be happening in Wisconsin because they have literally no orders in place, as far as I understand, except perhaps in certain local areas.
Hannah at the Daily Line. Governor, a deal has been reached on workers' compensation that enshrines the gist of what you wanted in your emergency rule with the ability for businesses to give a rebuttal. Do you regret putting that work comp rule forward since it was ultimately struck down by a judge and worked out among stakeholders anyway?
Well, I'm glad that both sides were able to work on getting something done because ultimately that's the best solution of all. As you know, we've been working in pandemic time, right? I mean, everything is moving very fast. Every day is like a week. And so we have to get things done. Decisions need to be made. And so, look, I'm glad that we've got the right answer.
Shia Politico, Chicago's mayor is still hopeful the tweaks for the Chicago casino will get legislative approval. What's going on with the negotiations?
I can tell you this, that I have encouraged every legislator that I talk to make sure that Chicago is able to get the casino bill passed. And it's very important, I think, for not only for the city of Chicago, for their pensions, but also for jobs that'll get created, and of course for the capital program for the state. Again, eventually casinos will reopen. I can't tell you exactly when, but just by passing that bill, at least gives Chicago the ability to to locate it, I don't know where they will, and then build that casino. So I'm very much in favor, and I want people to know that this is a hugely important priority for the city of Chicago.
Dave Dahl wants to know what exactly can get done in a day and a half.
Who asked that question?
Dave
Dahl. Dave Dahl, he should know that miracles can happen in a day and a half in Springfield. I've only had one May in Springfield, and we've seen an awful lot can happen in a day and a half.
Jim Haggerty at Rock River Times. The Archdiocese of Chicago submitted a plan for what it wants to do in Phase 3. We've heard from other faith groups who expect to be given the same provisions. Will all faiths have the same provisions in Phase 3 as the Catholic Church?
It's appropriate that's the question right after the miracles. But the answer is that the Catholic Church, I mean, every church is different, and mosque and synagogue, and so we've tried to provide guidance where we've been asked. The Archdiocese of Chicago did a terrific job with their plan, very detailed webinars and lots of detail. So I hope that other churches will take that lead from the Archdiocese.
Sarah at the Daily Law Bulletin. The AG today removed Rep. Bailey's lawsuit against you to federal court, and Bailey's lawyers have asked to keep it in state court. Why remove the case to federal court? Any response to Bailey's latest request to keep it in state court? That'll be our last one.
I mean, it's the Attorney General's office, handles these things. It's a legal matter. I mean, I would say, I think they felt like there were federal issues at hand.
All right. Thank you, everyone.
Thank you. Thank you.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.